Hello and welcome back to Patient Knowledge. My name is Dr. Kirmani and this channel is all about health education. I'm back with another video and today's topic is arthritis. So without further ado, let's get straight into it. In this video, I will give you an explanation about arthritis. What are the symptoms to look for? What are the types of arthritis? The joints affected? How is it diagnosed? What's the treatment? How can we prevent it? And we'll tell you about some of the myths related to arthritis. Now, what's arthritis? The word arth means a joint and itis is for inflammation. So arthritis means inflamed joints. It can happen in one or more joints that causes pain and stiffness, which gets worsened with age. For a better understanding, let's have a look at a healthy joint. Joints are places where bones meet. Now, bones, muscles, ligaments, and tendons all work together so that you can bend, twist, stretch, and move about. Now, the ends of your bones are covered with a thin layer of smooth tissue called cartilage. It acts like a slippery cushion that helps your joint move smoothly. Around the joint, there's a joint capsule which keeps your bones in place. And inside the capsule, there's a thick fluid called synovial fluid, which lubricates and nourishes your joint. Now, the ligaments hold the joint together by joining one bone to another. And your muscles are attached to your bones by tendons. Now, as your muscles contract, they pull the bones to make the joint move. Now, the types of arthritis. Well, there are about 150 different conditions that affect the muscles, bones, and joints. Some common conditions that fall under arthritis are osteoarthritis, rheumatoid arthritis, gout, ankylosing spondylitis, and juvenile arthritis. Osteoarthritis and rheumatoid arthritis are the two most common types. In general, the symptoms of arthritis are pain, swelling, stiffness, deformity, and disability. Today, I will be talking about osteoarthritis because this is the most common type of arthritis. Well, I've also made a video on rheumatoid arthritis. If you wish to have a look, please do check my video on osteoarthritis. Well, osteoarthritis is a problem of wear and tear because of excessive use and due to old injuries in the affected joints. The joints that are affected are mostly weight-bearing ones, such as spine, hips, and knees. Typically, the pain of osteoarthritis aggravates on activity and is relieved at rest. Now, the symptoms of osteoarthritis include pain, swelling, or stiffness in one or more joints, pain or stiffness in the back or neck, and pain and stiffness which happens usually after heavy activity such as gardening or doing any kind of housework, or even long walks, and sometimes getting up in the mornings can be difficult. Light activity might actually help relieve some of the symptoms. And in case of hip and knee involvement, a painful limp can be seen. Pain is the main feature in osteoarthritis. Well, pain gets worse by the end of the day, which is aggravated by use and is relieved by rest. It gets worse in cold and damp weather. There is variable morning stiffness with variable disability. And when you examine the hand, there will be hard and bony swelling with a sound called as crepitus heard on movement of the joint. There will be signs of inflammation where the joint may become red, hot, and swollen with restricted movements, and joint deformity appears in chronic cases. But how is it diagnosed? Based on the clinical features that I've mentioned before, and also doing some x-rays will help to diagnose this condition. X-ray findings may show narrowing of the joint space, formation of osteophytes on the bone margins, and there will be altered shape of the bone ends. What's the treatment of osteoarthritis? It's divided into medication and supportive treatment. Well, medication, it can be simple painkillers like Panadol or Panadol Osteo, or Nurofen and aspirin, but beware of the serious side effect of Nurofen or aspirin. It can irritate the gastric lining. So it can be taken only for short duration. But in very severe cases, injections at the joints, which are steroid injections, they are recommended for the relief of pain and to improve the quality of life. Some people benefit from taking glucosamine, which is a dietary supplement, and it helps to repair the damaged cartilage. Well, the supportive treatment includes exercise, physiotherapy, occupational therapy, use of heat application at the joint, and taking a healthy diet to reduce the weight if a person is overweight. This will take the load off the joints. Well, one should take enough rest during the active phase. Now, here's a list of foods that can ease arthritis pain. These are mostly anti-inflammatory type of foods. Here's another list of foods that can help in relieving the inflammation. And this is another list of foods that should be avoided because it causes inflammation. Well, the good news is that arthritis can be prevented by lifestyle modification. Maintain a healthy weight, eat a balanced healthy diet, exercise regularly, and prevent any joint injuries. Now here are some myths about arthritis. Many people believe that it's a disease of old age. Well, if it can happen even in young children, so that's the fact. Some people think there's only one type of arthritis. Well, the fact is there are so many different kinds of arthritis which can affect the joints. It's a popular belief that cracking knuckles would lead to arthritis. The fact is this cracking sound is heard only because of escape of air bubbles in the fluid and is not causing any damage to the bones or the joints, so it is not associated with arthritis. Some people think exercise makes it worse. Well, this is not true because exercise is essential in people with arthritis as it's important for one to keep their joints mobile. Osteoarthritis is unavoidable as you age. This is another myth. Well, it depends upon a lot of factors, such as any risk factors, any injury, or the lifestyle of a person. That's how they can get osteoarthritis. And by making lifestyle modification, you can actually avoid osteoarthritis. Some people think weather does not really affect arthritis. Well, the fact is it does affect arthritis to a great extent. If it's cold weather, the arthritis gets worse during that time. That's all for today. I hope this information was useful in understanding everything about arthritis. Thank you for listening. If you wish to hear something about, leave it in the comment box below. Bye for now.